We are Group 1, and we are going to be discussing types of managed care organizations. I'm Holly, and to begin with, the four most common types of health plans are health maintenance organizations, or HMOs, preferred provider organizations, or PPOs, exclusive provider organizations, or EPOs, and lastly, point of service plans, also known as a POS.
I'm Andy, and there are three major questions to ask when reviewing a plan as a consumer. Is there out-of-network coverage? Does that out-of-network spending accrue towards the member's out-of-pocket maximum? Do members need a primary care physician gatekeeper? So if I'm a person who has diabetes and congestive heart failure and need to see a lot of specialists, having a gatekeeper is probably not the best decision for myself.
This is Will, and I'm going to be talking about HMOs. And HMOs can be sort of viewed as a combined health insurer and healthcare delivery system. This is designed to provide coordinated healthcare services to all its members, and it's particularly focused on prevention and wellness care. And HMOs require you to have a PCP as your first stop of care. You are limited to the doctors, hospitals, and all sorts of facilities and care you would want by your region. So if you're out of its work area or you live far away, you can't really access the care of your HMO. Out-of-network doctors or any other providers are not covered. And currently, HMOs make up about 40% of active insurance plans.
I'm Zach, and I'm going to be talking about PPOs. In comparison to HMOs, no primary care physician is required in a PPO plan. And so if you need to go see a specialist, you don't need to find that referral in order to go see them. You can just go see them right away. Additionally, there's a larger number of providers and hospitals that are included in the PPO plan. And this is because you can either stay inside of the network or you can go out of the network and still have your care paid for. In some cases, however, going out of network, there will be more cost towards the patient for covering that healthcare. This type of plan usually also has higher premiums, which is the amount that you pay in health insurance every month, as well as a deductible or the amount of money you need to meet annually, as well as co-insurance or the percentage of covered medical costs that you have to pay after you've met your deductible, which is about usually 20%. However, this does cover a wide range of procedures, such as implants and orthodontics. There's a service-oriented care involved where oftentimes PPO private offices are dealing with a lower volume of patients in comparison to an HMO plan. Some other benefits are they have negotiated payment rates as well as rapid payment terms, meaning the PPO can commit to paying all claims submitted by providers within 15 days in exchange for a discount from the healthcare charges. So this is a benefit between the health insurance and the provider.
I'm Emily, and I'm going to be talking about EPOs, which are probably the least understood healthcare coverage plans. So for an EPO, you don't need any primary care physician gatekeeper. So there are no referrals that are required for specialty care, which can kind of speed up the process if you're someone who you need to go to a specialist. They do have a larger number of providers and hospitals, but out-of-network care is not covered, and there are no out-of-network benefits. So if you go outside of the network, the insurance plan will not pay for your health care. EPOs make up 7% of active insurance plans, and they are lower cost than HMO and PPO. And EPOs are currently on the rise with more insurance spots opening up.
I'm Nick, and I'll be briefly discussing POS, which is point of service. The unique point about point of service is that it integrates characteristics from both HMOs and PPOs. And with that, you pay less if you use doctors and hospitals and healthcare facilities that are within the network. The one drawback is that you must receive a referral from your primary care physician to see specialists. And that's something that it borrows from HMOs. So the primary care physician can become your point of service or gatekeeper. Patients are able to go out of network, but it is the patient's responsibility to fill out any required forms and send any bills for payment. And it's also the patient's responsibility to keep an accurate account of healthcare related receipts. And of course, in the end, this will result in higher costs by going out of network. And at the moment, POS makes up about 12% of the active insurance plans.
I'm Madison, and I'm going to summarize all of the different plans. So to summarize the different types of managed care organizations, we have a chart to quickly compare each type. POS and HOM plans require for the group members to have a primary care physician. This physician will dictate the specialist referrals for the patient and is often considered the gatekeeper of the member's healthcare. This allows the insurance company to manage the cost of the patient's healthcare and eliminates unnecessary specialist visits. PPO and EPO plans do not require for the group member to have a primary care physician and do not need referrals to specialists. However, PPO and EPO plans require pre-authorization from the health insurance company before receiving specific services. All four options have provider networks. Only PPO and POS plans will partially cover out-of-network visits. And since these insurance plans partially cover out-of-network visits, these group members are required to file claim paperwork on out-of-network only claims. Additionally, cost sharing refers to the group member paying for a percentage of the healthcare expenses in the form of deductibles, co-payments, and co-insurance. Cost sharing is typically lower for HMO and EPO plans. However, POS plans have lower in-network cost sharing and higher out-of-network cost sharing. PPO plans are typically higher, especially for out-of-network care. And overall, PPO and HMO care is the most used.